Somatic symptom and related disorders. Somatic symptom and related disorders are a group of mental health conditions. They are characterized by the presence of physical symptoms that are either disproportionate or inconsistent with any underlying medical condition. These disorders involve a preoccupation with physical symptoms. They are often associated with excessive thoughts, feelings, or behaviors related to the symptoms. Here are the main types of somatic symptom and related disorders. Somatic symptom disorder, SSD. Somatic symptom disorder involves excessive and distressing thoughts, feelings, or behaviors related to one or more physical symptoms. The symptoms may or may not have a medical explanation, but the individual's preoccupation with them is excessive and disproportionate. The condition often leads to significant distress, impaired functioning, and frequent healthcare utilization. Illness anxiety disorder, formerly hypochondriasis. Illness anxiety disorder is characterized by excessive worry about having a serious illness, despite having little or no medical evidence to support the belief. Individuals with illness anxiety disorder may interpret minor bodily sensations or normal bodily changes as signs of a severe medical condition. This preoccupation can cause significant distress and may lead to repeated medical investigations or doctor visits seeking reassurance. Conversion disorder, functional neurological symptom disorder. Conversion disorder involves the presence of neurological symptoms or deficits that are inconsistent with known medical conditions or do not follow typical neurological patterns. The symptoms often appear after a stressful event and may include motor disturbances, such as weakness or paralysis. Sensory disturbances, such as loss of sensation or blindness, or seizures that cannot be attributed to a medical cause. Factitious disorder. Factitious disorder involves the intentional production or feigning of physical or psychological symptoms for the purpose of assuming the sick role. Individuals with factitious disorder may go to great lengths to induce or fabricate symptoms, sometimes even undergoing unnecessary medical procedures or interventions. The motivation for this behavior is primarily to receive attention, care, and validation from healthcare providers. Other specified and unspecified somatic symptom and related disorders. These categories include disorders with somatic symptoms that do not fit the specific criteria for the disorders mentioned above but still cause significant distress or impairment. Examples include somatic symptom presentations in response to trauma. Somatic symptoms associated with a known medical condition, or persistent health anxiety without significant symptoms. Treatment for somatic symptom and related disorders often involves a combination of psychotherapy and, in some cases, medication. Cognitive behavioral therapy, CBT, is commonly used to help individuals recognize and modify their dysfunctional beliefs and thoughts related to their symptoms. Addressing underlying stressors and providing education about the mind-body connection can also be beneficial. In some cases, medication, such as selective serotonin reuptake inhibitors, SSRIs, may be prescribed to manage associated symptoms of anxiety or depression. It's important to note that somatic symptom and related disorders can be complex and require a comprehensive assessment by a qualified mental health professional. If you or someone you know is experiencing symptoms suggestive of a somatic symptom and related disorder, it is important to seek professional help for an accurate diagnosis and appropriate treatment.